These are some of my favorite male celebrity analysis videos from over the years. As you watch, please drop your thoughts in the comments below. Let's take a look at Simon Cowell and see when his face started to change. The answer will shock you. In 2001, at the age of 42, it looks like Simon has a low juvenile hairline with strong anterior temporal projection. He has low set, flat brows and upper lid hooding, which is relevant to his recent procedures, as you'll see later on. He also has this lower lid tear trough hollowing and rhytids as well, which are wrinkles at the under eye area. Simon looks to have thin lips and he has a strong chin. In 2002, at the age of 43, it looks like Simon has mild jowling as well as mild neck fullness. In 2003, at the age of 44, Simon has the descent of his lateral brows, meaning that the lateral brow is lower than the medial brow on the horizontal axis, and this is due to the lack of upward pull by the frontalis muscle lateral to the temporal crest. In 2004, at the age of 45, I see no change. In 2005, at the age of 46, it looks like Simon has started to receive Botox into his forehead and glabella, which he has admitted to.
Simon admits he overdid it with facial fillers and Botox injections in the past, saying there was a stage where I might have gone a bit too far. I saw a picture of me from before the other day and didn't recognize it as me.
In 2006, at the age of 47, I see no changes, and that's the same through 2008. In 2009, at the age of 50, it looks to me like Simon may have started cheek filler around this time. His cheeks just look fuller, and there's just this expansion of his face that I'm seeing with likely the use of filler. In 2010, at the age of 51, I am seeing some aging-related changes, such as that the lateral canthus is now lower than the medial canthus of the eye. And this is not the case in youth because normally the tears have to flow from lateral down to medial into the nose. So that's why the lateral canthus is naturally in youth positioned at a higher level, but as we age, it tends to drop down. In 2011, at the age of 52, I see no further change. In 2012, age 53, there are some obvious signs of continued Botox use with limited lateral frontalis injection, meaning that they're injecting the frontalis muscle, but not all the way to the side of that muscle, and that's why he still has those lateral wrinkles that are pulling his lateral brow up quite high. It looks to me like Simon may have either gained weight around this time or the continued use of filler has given him that larger, fuller look to his face. Some people call it filler fatigue. And keep in mind that there is a migration of filler that occurs over time, as well as more of a permanence to HA filler than we previously thought. There have been MRI studies that have indicated this, that filler, including HA filler, tends to hang around much longer in our bodies than we had previously thought. It may lose the aesthetic impact of how it looked initially, but it doesn't mean that the filler is completely gone. It can take many, many years before it starts to really break down. Also, it looks like Simon has additional neck skin laxity and some extra adiposity, which is basically fat deposits in the neck. In 2013, at the age of 54, I see no signs of change. Same in 2014. In 2015, at the age of 56, Simon has worsening brow ptosis, which is a sag of the brows. This could just be age-related. It could also be because of the continued use of Botox in the forehead muscle, since that's the only muscle that actually lifts the brow. So if you're paralyzing it, over time it gets weaker. Also, he has some upper eyelid dermatochalasis, which is excess skin of the upper eyelid, and he possibly also has some eyelid ptosis. And to me, it looks like he may also have functional visual field loss, given this extra weight that surrounds his eye. It might be even affecting portions of his vision. I think Simon has also continued to get cheek and under eye filler. In 2016, at age 57, I see no change. Same in 2017 at age 58. In 2018, at the age of 59, it looks like Simon is starting to lose some weight. In 2019, no change. And in 2020, at the age of 61, I just wanted to point out here that Simon is starting to develop these platysmal bands in his neck, and this is due to some midline dehiscence of the neck muscles, specifically the platysma, which is the most superficial muscle of the neck. In 2021, at the age of 62, it looks like Simon has continued to get cheek, under eye, and maybe even some lip filler. And in May of 2021, there were really no signs of upper face surgeries. We're going to play this video now.
It's been amazing, actually. I was saying earlier on how much you appreciate something when you've been away from it. I mean, I'm sure everyone feels that way right now.
Now let's fast forward to April of 2022. Simon announced that he was reversing his facial filler because his son was actually scared to look at his face. He seems to have pivoted towards a surgical solution, but one that was a major change on top of the filler that he was already dissolving. It's common practice for people to offer an explanation of their aesthetic change that's only a fragment of the actual truth. We've seen that many times. In September of 2022, Simon was actually on camera with Sofia Vergara for Wired. Take a look at this clip.
Yeah, I was a really, really bad kid. Yeah.
Oh.
Yeah, I never went to school. I was really, really naughty.
Yeah, but look at you now. It's fine.
Yeah, nothing's changed.
We actually have a video on Sofia Vergara. Make sure to check it out. It looks to me like around this time he already had a lateral brow lift, upper blepharoplasty, maybe a lower blepharoplasty as well, with a canthoplasty. And his upper eyelid just appears more hollow, and that's due to the combination of likely brow lifting and an aggressive upper eyelid skin removal. And on December 1st of 2022, this video surfaces of Simon.
I always say on this show, 2 or 3 minutes can change your life. And it has. And maybe this time it's going to be you. So please audition now for next year's season, and I'm looking forward to meeting you.
Some fans were quick to say that Simon looked unrecognizable.
It's not the first time that we've seen these changes, but as his face has gotten thinner from the filler dissolving, the combination of the eyelid and brow surgeries with the dissolving of the filler makes it a lot more jarring to our eye. Keep in mind that dissolving filler can thin out natural tissues, especially if high doses of Hylenex are used. Hyaluronidase is not only selective to exogenous HA filler that's in the filler syringes, it also has the ability to affect our natural tissues since we have hyaluronic acid in all of our cells. We have a video on lip filler dissolving where I show you my technique of how I dilute the Hylenex before putting it into the lips for dissolving old filler. I have a few thoughts on why Simon Cowell's recent facial changes went viral. Men rarely get smaller surgical tweaks along the way, so when they get a major overhaul, it's a lot more obvious to us. Any changes around the eyes need to be done with great care and calculation because they can really distort or change and affect the way that our face looks. It's more than acceptable to do a brow lift first and then see if you even need to remove any upper eyelid skin. Sometimes that process can be done on the same surgical day, and sometimes you do the brow lift, let it heal, and then see where exactly the eyelids fall to then potentially go back and remove some upper eyelid skin. Upper blepharoplasties can generally be done under local anesthesia, so it's not a difficult add-on procedure after you've made sure that the brows are exactly where you want them. The total cost of all of these potential procedures for Simon Cowell is $210,000. And here's what a before and after looks like. Today we'll take a look at Tom Cruise to see which facial plastic surgeries he may have had done. We'll reveal the cost of everything at the end, so stay tuned. In 1981, at the age of 19, you can see Tom with a low, youthful hairline with no signs of recession at all. You can see his strong eyebrows and notice how linear they are. In men, that's a very normal feature compared to in women where there's more arching in the brow. You can see the smooth lower eyelid to cheek transition with prominent lateral cheekbone structure. He has a very characteristic nose with tip bulbosity and bridge asymmetry. He's got very good lip definition, a strong chin and jawline, and a very acute cervical mental angle to his neck. In 1983, at the age of 21, notice the upper eyelid hooding that Tom has, although he still appears very youthful, vibrant, and does not look tired. Notice here how Tom Cruise has facial asymmetry, with the right side of his face being his bigger side in all dimensions. The right eyebrow sits at a higher level than the left. The right ala of the nose is positioned higher than the left. His right cheekbone is stronger and higher, and even the muscles on the right side of his face pull stronger than the left. And you can see with this smile that he has how the right side's being pulled more. And the nasal tip is also deviated towards that right side. And as we discuss in many other videos, this is normal, and we all have this to one degree or another. In 1985, at the age of 23, you can see how the shadowing in this photo highlights his incredible jawline definition and very masculine feature of a strong gonial angle. The gonial angle is this portion right here, this portion of the mandible. He has a relatively short philtrum with good upper tooth show. The central and lateral incisors are visible on the position we call repose, with the mouth gently open. In 1987, at the age of 25, you can see here his strong masseter muscle. That's the muscle right here that sometimes people put Botox into to help with things like TMJ or slimming of the face. But in Tom Cruise's case, it really helps define his gonial angle and provides definition there. In 1989, at the age of 27, he still has a very strong hairline, and he's starting to have some infraorbital hollowing that's right under the lower eyelid there, and he does have some gum show on his full smile view, so he would be a poor lip lift candidate. Please remember to subscribe to this channel. In 1990, at the age of 28, I think Tom Cruise has a nose that really helps define his looks. And even though it doesn't necessarily fit the textbook ideal, it's his nose, and it works for him. And it's an important reminder that you don't have to have a perfect nose to be very successful in life. In 1991, at the age of 29, Nicole has entered the picture. And when I zoom out and just take a look at Tom from afar, the key distinguishing features for Tom Cruise are his hair, specifically at the scalp and the eyebrows, and his jaw structure. In 1992, at age 30, there's no major changes. Same thing at age 31, 32, 33, and 34. I'm not seeing any major changes. In 1997, at the age of 35, I'm starting to see some early aging effects, with wrinkles on the forehead and the crow's feet becoming more pronounced. Also, the medial cheek appears more prominent. So that begs the question, did Tom Cruise get cheek implants around this time? Not totally clear, but it's possible, and that would have improved his infraorbital hollowing as well as just the cheekbone structure. Compare this to age 30, 5 years earlier, and we're going to point out here the left cheek contour change that I see occurring. In 1998, at age 36, no major change, same thing at age 37. In 2000, at the age of 38, Tom Cruise really hasn't changed too much, but at the age of 39, one thing to point out here is that the hairline in the central position does appear to be more thin. Now, to me, this doesn't look like something completely novel as I look back at his prior images, but it's just important to point out that this is one form of like a cowlick, where the direction of hair is splitting off. In the middle there, he has this thinner area. The hair to the right of that partition combs to the right, to the left of it's combed to the left, and in the center you have hairs that are starting to go more perpendicular, and so it creates this appearance of a thinner zone, and that's something that's been maintained over time for him. At the age of 40, I'm seeing some static forehead wrinkles. At the age of 41 in 2003, especially in this image on the right, I'm starting to think that Tom gets some lip filler because his lip is looking fuller than what it used to. Also, potentially, he had some cheek filler as well, because the cheeks are looking more filled in the medial and the lateral aspects of them. In 2004, at the age of 42, I'm not seeing any major change, as well as at the age of 43 and 44. In 2007, just something to point out, at 45 years old, he has flawless skin here, and this just is a testament to Tom Cruise's excellent skincare and all he does to maintain that. At the age of 46 in 2008, Tom has maintained so much wonderful hair. I don't think he's had a hair transplant, but what I do think is that he's been on very good medical therapy now for many years. And first-line preventative therapy, as I talk about in many of my other videos, is finasteride and minoxidil. And my guess is that Tom has been on both of them in order to maintain such good hair for so many years. In 2009, at the age of 47, I'm seeing signs of potential tear trough filler. You can see it starting to settle out on that right lower eyelid area. In 2010, at the age of 48, I'm starting to notice that the lateral brows are descending. The lateral brow will drop more than the central brow as we age, and this is something we're starting to see at about age 48 for Tom Cruise. In 2011, age 49, I don't see any major changes, and same thing at age 50. And 51. In 2014, at the age of 52, I'm starting to see some more fullness in the face. Now, this could be a result of some weight changes, or it could be the use of additional filler over time. Some people start to develop some filler fatigue, as we've seen with many other people. In 2015, at the age of 53, I'm seeing continued use of Botox, which is really helping with his forehead wrinkles, and continued skin care and probably some skin resurfacing over the years. At the age of 54, I'm not seeing any additional changes. In 2017, at age 55, we're seeing continued thinning of this central partition of Tom Cruise's hair. He also has some more static wrinkles, or as we call them in technical terms, rhytids, developing in his forehead and the glabellar area, as well as the crow's feet. And in the lower eyelids, we're seeing some pseudoherniation of fat. I don't see that in future photos, or more recent photos rather, so that to me suggests that maybe he's had a lower blepharoplasty. 2018, at the age of 56, there are no additional changes. Same thing at age 57. In 2020, at age 58, I'm seeing some signs of a potential facelift and maybe a fat transfer that was performed. When I look at his right tragus, I'm always pointing out the tragus areas because they can be a telltale sign of facelift surgery. The right tragus, to me, has changed shape. And we're going to show you a comparison to a 2015 photo. And the sideburn is now positioned higher than it used to be. As facelifts are done, oftentimes some of that sideburn skin gets removed, and with that, some of the hairs in that area, and it could make it so that there's a less prominence to your sideburn area, and the tragus can get pulled forward a bit, opening it up and giving away some signs of a facelift. I think maybe he's had it around this time. In 2021, this has now become a pretty famous picture. Age 59, Tom was like at a ball game, and people noticed that there was definitely more fullness in his face, and the question is, well, what may have caused that? I don't know for sure. It could have been, again, just changes in weight, maybe for a new role, maybe just happened to gain some weight. We all do from time to time. Maybe he's had the continued use of fillers in his face. That's possible too. Maybe he had some hormonal replacement therapy with testosterone, which is known to cause some degree of swelling as well. I remember doing a short clip on Zac Efron when he also showed up with a much fuller face one day. But it could also be something like a fat transfer. Fat transfers are used for a more permanent type of filler, and they're known to cause a lot of swelling that can linger for many weeks into months. And so potentially he had something like that to keep himself looking refreshed, but in the early period after the procedure could have gotten a bit of fullness in the face. 2022, at age 60, now it looks like there is less edema or less swelling in his face, so things have started to normalize a little bit. So on the high end, the total of all these procedures is $245,000.
From mogul to president, one thing has remained a subject of intrigue and debate: Donald Trump's iconic hair. Is it real? Did he get a hair transplant? It's actually much more complicated than that, and a great example of how hair restoration surgery has evolved over time. Dive in with me as I unravel the mysteries of Trump's trademark hair. Here's Donald Trump at age 4. And what I wanted to point out here is where his hair naturally parts on the left side. And what a natural part means is that is where the hair changes direction. And while you can artificially create a part anywhere along your hairline, there is a place where that directional split naturally occurs. In 1964, at the age of 18, you can see that Donald's hairline part is still on the left side, but he's choosing to comb it over to the right. He has a widow's peak right in the center there of the hairline, and he has early, slight frontotemporal recession. Before we go on looking at Donald Trump's hair, I wanted to point out his father's hair. In the 1970s and 1980s, you can see the fairly deep recession that his father had. But you can see that in the 90s, Trump Sr. has a lower hairline, and you'll see the relevancy of that later in this video. In 1976, at the age of 30, the exact degree of recession is difficult to assess because now the hair is being combed onto the forehead. In doing so, Donald Trump is able to conceal the frontotemporal corners. In 1978, at the age of 32, what I see here is that the architecture of Donald Trump's hairline has changed significantly compared to him at age 18. The hairline is now much straighter, it's lower, and it appears to be less natural. And if you look closely, you'll see what appears to be small islands of hair. I believe that he may have had a procedure which involved plug grafts. Plug grafts were first popularized in the 1950s by Dr. Norman Orentreich in New York City. He would essentially take 4mm size punches from the back of the head and move those islands of hair to the front of the scalp typically and suture close the donor sites. But these islands that were moved were not the follicular units of today. They were much bigger. Currently, for FUE technique, for example, we have usually about a 0.8mm to maybe a 1.0mm punch size. Compare that to the 4mm punch sizes of the past. When these larger islands of hair were moved, they appeared less natural, giving almost a doll's hair type of appearance. In 1979, at the age of 33, you can see that it's almost like his entire forehead is being covered by hair. And part of the reason for that is that the hair plugs have been placed low. In 1980, at the age of 34, I wanted to highlight the horizontal thirds of the face. And as you guys know from my other videos, we talk about how the horizontal thirds of the face classically should be relatively equal in height. But as you see in this image, the top third of Donald Trump's face is now significantly shorter compared to the middle third and the lower third. And this is especially true as you look back at how he was at age 18. You know, when I have consultations with patients, they'll often ask me, like, why should I choose you? There's so many people in New York City and, around the world that do hair transplants. And what I often say is, you definitely want to find someone who's an artist and not just someone who does hair transplant surgery. An artist will be able to properly configure a hairline as far as positioning goes that fits your face appropriately. You want somebody who understands facial proportions and general aesthetics. In 1981, at the age of 35, you can again see the pluggy appearance of the hairline, and you can see the orientation of the hairline being straight across. In 1982, at the age of 36, the plugs are still visible, and you can see that as we zoom in on the left side of the hairline. In 1985, at the age of 39, in addition to the procedures that we have already discussed and what we will be discussing, Donald may have also been on finasteride around this time. Finasteride is what allows us to preserve our hair. It won't necessarily lead to a lot of hair growing back, but it does help protect what we have. And that's a very important part of hair restoration. To find out more about finasteride and other hair restoration medical therapies, head to feelconfident.com. In 1991, at the age of 45, what I see here is that the left frontotemporal corner looks different, with some scarring visible at the part line. Now, perhaps Donald may have wanted to cover up the hairline plugs, and a new popular technique was emerging in Beverly Hills around that time. I believe that Donald Trump may have had a rotational flap from the left side. Let me explain what that means. first described in 1975 by Urey as the temporoparieto-occipital scalp flap. It was later popularized in the United States by Fleming and Mayer in Beverly Hills in the 1980s. A flap operation relocates large areas of dense, growing hair. You can use this technique to create a complete hairline in the shortest period of time compared to other surgical options. And each flap has about 6,000 to 10,000 follicular units. And some of the results that I've seen are truly impressive, especially for patients that are Norwood 6 and 7. The flap is based on the temporal artery and its connections to the retroauricular and the occipital arteries. These flaps come in two different varieties. One is pedicled and the other one is a free flap. The pedicled flap, as it's rotated in, has hair growing in the posterior direction at the hairline, so the scar becomes more visible. Flaps can be performed from either side if more coverage is needed, and areas of alopecia in between those flaps can be removed. And this is what's called a scalp reduction. And some people online have speculated that Donald Trump may have had a scalp reduction, but I believe that it was most likely in combination with one of these flap procedures. The risks of these rotational flaps are poor scarring and potential flap necrosis, which occurs at least partially in 4 to 5% of cases, even in expert hands. So these bigger procedures do have bigger risks. In 1992, at the age of 46, even though Donald may have brought in a fresh supply of hair to the hairline, he's still combing it down, and this might be to hide the scar. Also notice here that the hairline height has been further lowered, shrinking down the upper third even more. Going back to Donald Trump's father, you can see that he may have had a similar procedure around this same time. And notice the scar at his hairline, as the flap was most likely pedicled, therefore giving it the posterior direction of hair growth and increased visibility to the scar. In 1993, at the age of 47, it is difficult to tell if he may have had a second flap from the right side with or without a scalp reduction, because he overall has good coverage in the mid-scalp and the crown areas. In 2002, at the age of 56, it looks to me like Donald Trump's hairline is now more robust. The right temple and the right frontotemporal area appear more concealed. Now, it's possible that he may have had an FUT procedure around this time. FUT was first described in 1995, but it was the most popular method around this time in 2002. Remember that FUT surgery involves taking a strip from the back of the head and dissecting that under the microscope to get follicular units, and then taking those follicular units and placing them as these mini or micrografts at the hairline or other places that might need additional hair. This can be done to help conceal scars and also to increase the overall density of an area. In 2003, at the age of 57, you can see the significant boost to Donald's hairline, but also the forehead is now nearly completely covered by hair. In 2004, at the age of 58, what I see here is that when you look at the posterior perspective on the left-hand side, there is a scar pattern that's consistent with the rotational flap that I previously described. As we superimpose a rotational flap design onto what we're seeing here with Donald Trump's hair, you can start to appreciate that perhaps this is where the flap originated. In 2009, at the age of 63, I'm starting to see some frontal scalp thinning. And again, given that the hair is being combed posterior and it's covering up a lot of the mid-scalp and crown, it's more difficult to assess those areas. In 2011, at the age of 65, the frontal scalp again is starting to look more full. And it's possible that he may have had an FUE surgery around this time. FUE surgery involves taking out hair from the back of the scalp, similar to FUT, but this time with individual punches that are made and scattered throughout a donor area. FUE was described in 2002, but became more popular around 2010, and it continues to be the most popular extraction method today. In 2012, at the age of 66, the way that the hair lifts in the wind from the front may be a reflection of that original rotational flap. In 2018, at the age of 72, we see some images of scarring, and that scar that's visible on the left may be related to that suspected rotational flap. But on the right side, there's also a visible scar. And the way that his hair flops in this video, it looks to me like he might have had a right-sided rotational flap in the past as well. Historically, those were sometimes done 1 to 2 months apart. You can do a left-sided flap for the more anterior portion of the hairline, and then after a few months, a flap from the contralateral side was used further back to add further density to the frontal and mid-scalp. And then the area in between those two flaps was further reduced with a scalp reduction procedure. And this can all help explain the complex combing that's involved in getting Donald Trump's hair to look the way that it usually does. So to summarize the potential procedures that I think Donald Trump may have had on his hair, let's start with punch grafts in the 1970s, followed by a left rotational flap in around 1991, with a subsequent possible right-sided rotational flap around the same time. Then an FUT procedure in 2002 and an FUE procedure in 2011. Now you see what I meant by this is a complex case. Ryan Gosling has been at the forefront of male beauty standards for 3 decades. Has plastic surgery played a role in his appearance over the years? Let's follow his evolution. In 2001, at the age of 21, what I'm seeing is that the right frontotemporal corner is slightly more recessed than the left side, and this is the case in 90% of people. But if you look at natural patterns of the direction of hair growth, as you get closer to the right corner, usually the hair on the right side of the hairline tends to fall over to that corner, essentially allowing you to cover it up. And that's the pattern that I see with most of my hair transplant patients. Ryan also has some curvature to his forehead, and what that can sometimes do is give you the illusion of a higher hairline than you actually have. In 2002, at the age of 22, Ryan has a small dorsal hump on his nose. He also has about a 90-degree nasolabial angle. Contrast that with Margot Robbie's nasolabial angle, and you'll see the difference between a more ideal male aesthetic compared to a more ideal female aesthetic. Ryan Gosling has a flatter upper lip structure, and he has a strong lower jaw. In 2003, at the age of 23, Ryan has great eyebrow fullness. He has upper eyelid hooding with a possible congenital ptosis on the left eye compared to the right. Ryan also has lower eyelid hollowing, and he has that prominent orbicularis oculi muscle at the lower eyelid. What I'm seeing are actually signs of a potential rhinoplasty, and it may have been coupled with a septoplasty at the same time. His nose appears straighter and more narrow from the frontal view. It's pretty common to combine a septoplasty with a rhinoplasty. A septoplasty is when the central partition of the nose is modified to essentially create a straighter path for air to flow. So when people can't breathe well from the left side of their nose or the right side of their nose, a septoplasty can sometimes help in the right candidate. Now, a septoplasty can be combined with a rhinoplasty to change various elements of the external structure of the nose as well. This can be for functional reasons such as improved breathing, but it can also be for cosmetic reasons, such as making the bridge of the nose more narrow or defining the tip of the nose. Once again, when I look at Ryan's nose from 2002 into 2003, the main changes are that the bridge of the nose just appears more defined, and the tip of the nose as well. There's less bulbosity to the tip of the nose. His nose, to me, appears more midline, and it appears straighter and more defined than prior. In 2004, at the age of 24, what I'm seeing here is that Ryan does have a prominent left ear. It tends to stick out a bit more than his right side. The left ala of his nose is larger than the right. And some people end up getting alaroplasty procedures to try to adjust the nostrils and to make the alas more symmetrical. And what I'm noticing in this photo here is that there's some missing beard hair on the left medial cheek. And this is something that you'll see in years to come as well. There is some missing hair as well on the right medial beard, but on the left, there's less density. In 2006, at the age of 26, there's more facial fullness. And this is particularly true in the medial cheeks. And this could potentially just be a result of some weight changes that have occurred. You can also see that Ryan has a very prominent and strong brow ridge. This is quite a masculine feature. And when you look at his nose from the profile view, you can see that there's columellar show. It's a good exercise to try to differentiate columellar show from alar retraction. Both can give the appearance of a heaviness down at the bottom of the nose, but alar retraction is when you actually have a lifted ala here. The rim of the ala is actually lifted, and so it looks like you have more nostril show. It's not so much that your columella is hanging low. Alternatively, like in Ryan's case, the ala is in a very natural position, and you can see that there's some prominence to the base of the columella here, or the base of his septum. In 2007, at the age of 27, I'm noticing that the forehead and the glabellar rhytids are more pronounced. And in 2010, at the age of 30, I'm seeing some signs of a potential brow lift. Now, when you look at the shape of his eyebrows, the medial portion, or the portion closer to the center of his face, is more lifted now compared to the year prior. His eyes now appear more open. But you can notice that the upper eyelid ptosis, specifically on the left side, still remains. People get brow lift procedures generally to look less tired and to rejuvenate the eye area or the periorbital area. And in men, you have to be very careful when doing brow lifts because you don't want to feminize the face. And that can be a tricky balance because you want to lift the brows so that there's less heaviness on the eyes, but at the same time, you don't want to create too much arching of the brows either. And in 2011, at the age of 31, what I'm seeing is that there are really no signs of increased forehead height despite the brow lift, because most brow lifts will actually increase the forehead height as the hairline gets pulled back. And this is true even with endoscopic approaches to brow lifts, which are some of the more modern approaches, but they still have the potential to elevate your hairline or to increase the forehead height. And I'm not seeing that in Ryan's case, which is great. And his hair, as he enters into his 30s, is still looking fantastic. To keep your hair looking as optimal as possible, make sure to check out feelconfident.com. In 2012, at the age of 32, I see no change, and that's the same through 2016. In 2017, at the age of 37, I'm seeing some signs of potential lower eyelid filler. He had previously addressed the upper eye area, and now the lower eye appears less tired as well. And now that the lower eye area has also been addressed, he appears even less tired and more alert. In 2018, at the age of 38, what you can see is that Ryan has a more pronounced upper nasal rhytid. This horizontal crease that runs along the upper part of his nose is caused by the procerus muscle. This is a muscle that lives right here at the top of the nose, right at the bridge, and it runs vertically. And that's what we see with all lines and deep wrinkles of the face, is that they're running perpendicular to the belly of the muscle. In 2019, at the age of 39, I'm seeing the potential introduction of cheek filler, especially into the medial section. So oftentimes when we age, the cheek falls down and into the middle of the face. And that's the general trajectory that it has. So it can sometimes be more obvious when people get filler placed into their cheeks that's being done more into the central part as opposed to out here into the lateral part of their face. In 2022, at the age of 42, what I'm starting to see is that now 12 years later, after his brow lift, the brows are again starting to sag. And now they look close to their pre-brow lift position. And that's what we see with most types of lifts. Even if it's done really well, after about 10 years plus, there is a sag that occurs inevitably as we all age. So whether it's a facelift, a brow lift, a lip lift, most types of lifts will start to fail eventually. And some people go back to get that procedure repeated to bring them to a more rejuvenated, lifted state. Nothing lasts forever. And in 2023, at the age of 42, I also see no change.
And the total cost of these potential procedures is $75,000. Goal! Let's take a look at Cristiano Ronaldo and figure out if he's had any facial plastic surgeries, or is he really naturally that good looking? All estimated costs and a before and after photo are revealed later, so stay tuned. In 2003, at the age of 18, what I see here is that Cristiano has short upper and middle thirds of the face. He has a minimal nasal dorsal hump, and at baseline he has upper lip arching with upper tooth show on repose when he opens his mouth. Make sure to watch our video on what all models have in common to learn more about this phenomenon. Also, Cristiano has full lateral cheeks and the medial cheeks appear flatter. Notice his jawline at the angle of the jaw and pay special attention to the slope from the ramus of the mandible all the way down through the body of the mandible. We'll be coming back to that later on. In 2004, at the age of 19, what I see here is that Cristiano has temporal hair that has nicely framed his face. And this is a major part of male pattern hair loss, actually. When the temple starts to recede back, it's not so much that we're just getting the corners revealed, but also the entire face starts to look broader and the whole forehead starts to open up as the temples push back. But as you see in Cristiano's case, he has really nice anterior projection of those temples, giving him a very youthful look. As a side note, since 2019, Cristiano Ronaldo actually co-owns a hair transplant clinic in Spain. I found that interesting. Ronaldo also has a prominent masculine brow bone. In 2005, at the age of 20, Cristiano has full tooth show on smiling, and it's clear that he's had a full smile makeover. He's had a series of veneers placed, and when you compare back to 2003 and 2004, you can really see what a major transformation has occurred. In 2006, at the age of 21, I don't see any changes, and this is the same through 2009. In 2010, at the age of 25, the major change that I see here is that I think Cristiano may have had upper and lower jaw implants. It's likely that there was a malar cheek implant placed as well as a gonial angle implant. It looks to me like he's had a filling in of his medial cheek volume deficit. Now, could he have had filler instead? Sure, that's always an alternative option for filling in the cheek area, but it looks to me like the appearance of the cheeks look about consistent throughout the years to come. So I think that it's possible that he may have had an implant. Also, when you follow the ramus of his mandible down through towards the body of the mandible, what you will notice here is a contour change. It looks to me like there is a lateral bowing of the area as you reach the angle of the mandible. Compare that to prior, where the overall slope and contour appears to be bowed in. Now there's a bowing out of that area, and so that to me is a major change in Cristiano's face. He may have had a off-the-shelf type of implant where you just buy a pre-made type of implant that matches the overall shape that you're going for, but he also, given his resources and given his status, he may have had a custom 3D type of implant that's prefabricated based off of a CAT scan to actually fit the face as perfectly as it possibly could before you go in for surgery. So you have this custom type of implant that then gets placed into the area right over the jaw. When it comes to facial implants, the incisions that are used for placing these implants are usually done on the inside of the lip, both on the upper lip to get to the maxilla or the upper jaw, and on the lower lip to get to the lower jaw. And so you're not going to see any scars from the outside. You'd have to really raise up the lip or lower the bottom lip to be able to see where these incisions were placed. So it can be very difficult to detect that someone's had this type of work done. Also, the question becomes, well, why even get these implants? And what's the purpose? Is there a functional purpose? Not really. Is it just for aesthetic gain? Pretty much. The thought is that if your jaw is a bit more prominent in the angles, and if the upper jaw has nice fullness to it, you'll look less tired, you'll look more youthful, and also more masculine. So that is most likely why, majority of guys who are getting these type of implants are doing it in the first place. I find it interesting that around 2009-2010, Ronaldo actually signed for Real Madrid in a transfer worth 94 million euros. Could these potential procedures have corresponded with his growing popularity and worldwide fame around that time? Let me know what you think in the comments below. 2011, at the age of 26, I'm not seeing any further change. Same in 2012. Compared back to age 18, you can see that in this photo from 2013, the outline of the potential malar implant is quite visible. In 2014, at the age of 29, it looks like Cristiano may have started on Botox to the forehead, the glabella, and the crow's feet. He now has smoother skin to pair with his effective skincare routine. Now, when performing Botox for men, you have to keep in mind that the muscle that you're injecting into, in the case of the usual locations, right, the frontalis muscle for the forehead, the corrugators for the glabellar area, and the orbicularis for the crow's feet, they're usually stronger in men, and typically what that translates to is more units of Botox for the same effect. So it's very common when a guy comes in for Botox, he would typically get underdosed by a clinic that is performing a lot of Botox, say mostly on women. So there has to be that dose adjustment that occurs so that the muscles that you're seeing on men, especially men who are using their muscles quite often and athletes, need to be dosed properly to get the same visual impact. In 2015, at the age of 30, I'm not seeing any change, and that is the same all the way through 2022. The total cost of Cristiano's potential procedures is $140,000. And here's a before and after. Some people think that Harry Styles is actually bald, like me. They say that he's wearing a wig and that he's actually lost his hair. I'm gonna take a look at his hair and address this conspiracy once and for all. I'll put it all together and let you know what I really think at the end of the video. This one is gonna surprise you. In 2010, at the age of 16, Harry has what looks like to be a Norwood 1 pattern with strong anterior temporal peaks and little to no frontotemporal recession. In 2011, at the age of 17, this is a common hairstyle for Harry in his teenage years, with his hair coming down and covering part of his forehead. In 2012, at the age of 18, now it looks like Harry has more of a Norwood 2 male pattern. To review some of the basic terminology, we have the widow's peak, and that's this area right here at the center of the hairline. We also have frontotemporal corners, or the frontotemporal recession areas. And of course, we have the temples that are located just south of the frontotemporal corners, and they're right above the sideburn area. You can see that Harry's temples have started to recede laterally. His temples are now further away and pulled away from the eyebrows than they were just a few years prior. He has a strong hairline with some baby hairs present as well. In 2013, at the age of 19, Harry here has a similar hairline pattern. Either he's preserved this pattern naturally, or he may have started on something like finasteride. We know that finasteride has a strong ability to prevent further hair loss in most men. Keep in mind that some men will experience really significant hair loss in their teenage years. I've even seen some Norwood 7 cases in, say, 18 or 19-year-olds. And that's an important reminder when we start to consider doing hair transplants at younger ages. Of course, we have to be careful when offering a hair transplant to a younger patient. However, when someone has such an advanced pattern in their teenage years, what would be the reason to wait even longer to offer them a potential transplant? Something to consider. And I would argue one of the wrong medications to start on when you're starting to see frontotemporal recession at a younger age and you want to prevent further loss would be topical minoxidil. And I have a whole video on why I think that's not a great first choice. But unfortunately, that's where most people start and their hair loss continues. In 2014, at the age of 20, you can see that Harry has deeper recession on the left frontotemporal corner compared to his right. And this occurs in only about 10% 10% of the population. In most people, usually the right side recedes more than the left, and that's true in men and women. So Harry Styles is in the minority with his hair loss pattern. Keep in mind that the younger you are when your hair loss starts, the more potential you have to end up with a more advanced pattern of hair loss at a younger age compared to someone who just starts to thin and recede later in life. This of course makes intuitive sense, because if you're already starting to have significant hair loss in your teenage years, how will it look when you reach your 20s, 30s, and beyond? So the population where finasteride has the strongest potential to really help limit progressive hair loss is in this younger population, which of course is the population that's least likely to be A, interested in a medication that they have to continue to take the rest of their life, and B, compliant with the medication because of all the other things that they have going on in their lives at that age. In 2015, at the age of 21, I see no change. And in 2016, at the age of 22, I also see no change. In 2017, at the age of 23, you can see that Harry Styles' crown is still quite strong. Remember that the main areas of the scalp, especially when it comes to the DHT sensitive zone, is the frontal scalp, the mid scalp, and then the crown. The crown on all of us has at least one area of a whorl pattern, and that's where the hair starts to rotate on itself, and that gives the appearance of some subtle thinning in everyone. This thinning is mainly due to directional changes that are occurring around that whorl. You lose that shingling overlap effect that you may have on other areas of your scalp, such as the frontal area. In 2018, at the age of 24, I see no change. In 2019, at the age of 25, Harry is moving towards a Norwood 3 hair loss pattern, specifically on his left side. He's starting to develop more pronounced hairline asymmetry, but his overall hair density is still quite strong. So in my opinion, in a situation like this, he's unlikely to benefit from minoxidil, whether that be the topical formulation like Rogaine or oral minoxidil that we know is more potent than the topical minoxidil, but is only meant to increase the thickness or the caliber of our hair shafts. And as it does this, it gives us more hair fullness, but it's not going to bring back hair in areas where you've completely lost it, like in Harry's case, the frontotemporal corners. So if he came to me for clinical advice, I would say thumbs up to finasteride for reducing progressive loss of those areas and keeping the great hair that he has at this time point. But the use of minoxidil is unlikely to change much for him clinically. It would only expose him to some potential side effects. And the additional recession that we're seeing on his left side suggests that he's either not on finasteride or he's on finasteride, but he's falling into the 8 to 10% of men who continue to see progressive hair loss even on the standard dose of oral finasteride at 1 milligram a day. Some men who are on the 1 milligram a day dose feel like they're doing everything possible to prevent further hair loss, or if they continue to see progressive recession. But oral finasteride in its standard dose will be effective for preventing hair loss in about 90 to 92% of men. The rest might have to consider bumping up the dose of finasteride or switching over to its more potent cousin, dutasteride. The difference is that dutasteride blocks all the isoforms of the 5-alpha reductase enzyme that's blocking the conversion from testosterone to dihydrotestosterone. If you're looking to reduce your hair loss, make sure to check out the products that we have at feelconfident.com. In 2020, at the age of 26, I see no change. In 2021, at the age of 27, I see no change. In 2022, at the age of 28, this is around the time when rumors started to swirl that potentially Harry Styles had a wig or a hairpiece. It definitely does not look like that to me. He still has a natural hairline and his usual degree of recession. He has those finer hairs that are blending into his thicker hairs, which is very natural. And he also has some irregularity along the hairline that's very difficult to recreate with a hairpiece. And that left side being more receded than his right is still very much in keeping with with what he had previously, so there's no reason to think that he's now wearing a wig. But in November of 2023, at the age of 29, Harry debuted a shaved head for the very first time. And some speculated that this was a reaction to the release of a Taylor Swift record called 1989 that she released 1 month prior in October of 2023. And in that record, she actually referenced Harry's hair. But maybe it wasn't because of that record. Maybe it was because of something else. In 2024, now at the age of 30, what you see here is that the contour of Harry's left frontotemporal corner now looks different. It looks less angular, it looks less receded, and it looks more rounded and more symmetrical with his right side. However, his temples and his central hairline appear unchanged. So my hypothesis is that Harry's head shaving 1 year prior was actually related to a potential hair transplant to balance out the contour of his hairline. Now, this was a subtle type of hair transplant. This wasn't something involving 3,000 grafts. This was something that may have only involved about 200 to 500 grafts, likely with the FUE or the follicular unit extraction method from the back of the scalp into that left corner. And they likely shaved his head for that procedure. And I think that's why he debuted that shaved head in 2023. If this is true, it really shows the power of today's hair transplant surgery, how it can restore balance and symmetry to the hairline in a very natural way. This wasn't possible in the past, but with today's technologies and the proper artistic vision that I'm always talking about on this channel, it is possible to have a hair transplant and to have nobody notice that you did it.
People online have speculated that Chris Brown may have had a hair transplant, a brow lift, a rhinoplasty, or even a lip reduction. Are there signs of any of these claims from his photos from over the years? Let's take a look and decide for ourselves. In 2007, at the age of 18, you can see that Chris has a nice shape up with his hairstyle. He has strong temporal points, and these are sometimes what I have to create surgically, but he has them naturally. He has horizontally based brows. He has some upper eyelid dermatochalasis, which is just some excess tissue in that upper eyelid region. He has a wide nasal base with some alar flaring, and he has full lips with upper tooth show on repose when he parts his mouth. Chris also has a strong jawline. And in 2008, at the age of 19, what we see here is a strong frontal brow ridge, which is quite masculine. And he also has full tooth show when he smiles. His upper to lower lip ratio is about a 1:1. In 2009, at the age of 20, when I look at the right side of Chris's hairline, he has this whorl pattern, and that's what gives it some of that irregularity. Now, some patients have a whorl pattern only on their crown, whereas other patients might have whorl patterns along their hairline. I've seen it just in the central part of the hairline. I've also seen it out laterally. So to my eye, Chris seems to have one that's more right-sided along his hairline. Chris also, in these photos, has some slight frontotemporal recession. It's very minimal, but you can see it starting to happen, even though he's only 20 years old. I do have some patients that are in their late teenage years that are nearly Norwood 6 and 7. They've lost a significant amount of hair, even though they're quite young. So sometimes with male pattern loss, it can present quite early and it can be quite advanced. So I was looking at these photos and wondering, could these be some signs of a brow lift here or maybe even a blepharoplasty? Honestly, it's unclear. There are no clear signs of scars. I'm not sure if at age 20 he would have taken the risk with such short hair to get a brow lift, because clearly they didn't do a direct brow lift because we don't see a scar along the brow. They wouldn't have done a, mid forehead type of incision because, he's 20 and this would have been in the middle of his forehead, and his wrinkles aren't yet fully set in where, you wouldn't use that as a potential spot for an incision. An incision by the hairline or just behind the hairline would have been quite obvious to detect with his hairstyle. So I just don't see it, even though the brow to me looks slightly elevated more than before, and there's now reduced impact on the supratarsal area, I still have doubts on whether or not he actually had a brow lift or a blepharoplasty. And in 2010, at the age of 21, I see no change. In 2011, at the age of 22, Chris has started to dye his hair. And you have to make sure when you're dyeing your hair to just practice just safe kind of basic precautions for hair dyeing. And that includes reducing exposure to harsh ingredients like ammonia and hydrogen peroxide. With frequent dyeing of one's hair, you run the risk of developing some brittle hair and also irritation to your scalp. So try to reduce the harsh ingredients and try to reduce the frequency at which you dye your hair, if that's something that you do. In 2012, at the age of 23, I see no change. And in 2013, I also see no change. In 2014, at the age of 25, when I look at Chris's nose, I saw some speculation on whether or not he had his nose narrowed and built up along the bridge. To me, it looks very similar to his original nose. So I would say that I see no signs of a rhinoplasty. In 2015, at the age of 26, when I look at his lip volume, again, compared to 8 years prior, it looks unchanged. I don't think that, at least at this point, that he's had a lip reduction. A lip reduction is a procedure that can reduce the red portion of the lip, either on the upper lip or the lower lip. Sometimes it's used for a global reduction when people just feel that their lips are too full and they're trying to get the upper lip or the lower lip to look just thinner. It can also be done for a localized type of procedure where you're trying to address either a scar or some specific tissue prominence, and so you can just reduce that one area to make the lip look more even overall. You can do it globally, or you can do it locally in one specific spot. And I think one of the reasons why people are guessing that maybe Chris Brown had a lip reduction is because they're looking at his lips, but from different distances from the camera. So as we get closer to a camera, our facial features look bigger. And that's why in selfies, most of us have like a bigger nose or bigger lips. As we move away from the camera, the facial features start to look more like their normal size. And so when assessing someone's face and trying to figure out how they had these procedures, it's important to keep in mind facial proportions and not just to jump to conclusions about, let's say, the lips by just looking at only the lips and not in relation to other facial features. So in my estimation, I don't see any signs of a lip reduction in Chris's case because I've looked at those different distances from the camera and how they relate to his other facial features. And when it comes to his hair, the frontotemporal hair loss has slightly increased. You can see a more recessed corner on both sides compared to prior. In 2016, at the age of 27, Chris has started to adopt some of these tighter hairstyles. And remember that a tighter hairstyle can lead to traction alopecia. Because of that pulling on the root of the hair or the hair follicle, you start to build up inflammation. And if you continue to have that tight style, you can start to lose some of those hairs. And it can be permanent if it's not reversed quickly enough. So in addition to some of the risks for your hair associated with hair coloring, make sure to also be careful with how tight you wear your hair. And in 2017, at the age of 28, I see no change, and that's the same through 2021. In 2022, at the age of 33, now that Chris Brown is in his 30s, his cheekbones have become more prominent. And that has to do with, in part, weight loss, most likely, but also as we age, the quantity of fat in our face diminishes. And that's one of the reasons why I speak up against buccal fat removal when people are much younger, because later on they'll be wishing that they had that fat back. But in Chris's case, I don't think he's had any buccal fat removal, but I do see this cheekbone prominence as some of the other fat in the face has started to thin out. When I look at Chris's nasal base and his tip, they look similar to me compared to the original. I really don't see any obvious signs of plastic surgery or say something like a nasal filler. To me, it looks quite similar to the original. Also, in looking at his lips, specifically the amount of tooth show that's there, I again think that it's unchanged. And a lip reduction has the tendency of exposing more of your teeth. So because we see about the same amount of tooth show on the upper teeth and the bottom teeth, I don't think that he's had a lip reduction on either the upper lip or the lower lip. In 2023, at the age of 34, tattoos on the face are not exactly like tattoos anywhere else on the body. The facial skin tends to be thinner than other areas of body skin, and when you have thinner skin, when you go in with the needle to do the tattooing, if you go too deep, which is more likely with thinner skin, you can start to get these bleeding lines and a blown out type of result. Also, our face is more exposed to the sun, so with that constant sun exposure comes different changes to our facial skin, and that can of course also affect the appearance of a facial tattoo. And when we wash our face daily, such as with the Feel Confident facial cleanser, what happens is that the tattoos on our face can start to fade quicker. And when someone is dissatisfied with their tattoo, they'll sometimes either get a different design over the original, or they might want it laser removed. But it is difficult to laser remove a tattoo completely. So when it's on your face and you no longer want it there and you go in for that lasering, what you'll find is that there'll still be some semblance of the tattoo. Even though it'll be less obvious, it will still be there. And so that's something else to remember about tattoos on the face. And if someone is interested in getting a facial tattoo, I think it's very important to find a subspecialist tattoo artist who really knows what they're doing with that part of the body. Similarly, when someone is getting like a facial plastics procedure, it's important to go to someone who does this stuff all the time. And the more specialized they are, I think the higher your chance of success for that procedure. And when it comes to plastic surgery, we have our list of recommended plastic surgeons on the Feel Confident website, so make sure to check that out. And this year, in 2024, there's been some speculation about a potential hair transplant towards like the end of last year. When I look through all of these photos, first of all, he's wearing lots of hats lately. So at first I was like, well, maybe there is something there. But he did not have his hat on for the podcast in November of 23 with Funny Marco. And to me, his hair looks pretty much unchanged. And when I look through even some of the highly edited types of images, I think maybe they use some makeup to sharpen some of the lines, but I don't see clear evidence of a hair transplant for Chris. And so to me, I think Chris's hair has been fairly stable since about 2015. And the question is, with the recession that he was developing in the years prior to 2015, how is he able to stabilize the hair and not continue to recede? It's possible that that was just his pattern, that he was always destined to have that pattern and it wasn't going to get worse on its own. But it's also possible that he actually started medication to help stabilize that hair. And the main medication that does that is finasteride. Finasteride is most commonly prescribed as a pill, something that you take daily, but it can also be prescribed as a topical formulation. That is off-label use, but something that is done and is still effective with reduced side effects. So if you're looking to potentially get on finasteride to try to prevent your own hair loss, make sure to check out feelconfident.com, where you can get the medication affordably delivered right to your door. So the brow lift and/or a blepharoplasty is the only potential procedure that I see some signs of. But again, I have my doubts given his age at the time that I started to see those changes and the type of scarring that would have led to. And I don't see the signs of scarring. So even though I do appreciate some change in his brow position, I'm not convinced that he actually had surgery. I see no signs of a lip reduction, a rhinoplasty, or even a hair transplant.
Let's take a look at Keanu Reeves and see if he's had any potential facial plastic surgery procedures. Stay tuned for the side-by-side comparison and for the price of possible procedures. In 1989, at the age of 25, you can see that Keanu has eyebrows that are slightly arched as you move laterally. He has a strong frontal brow ridge. And when you look at his nose, as far as the tip shape, he has cephalically positioned lateral crura. And what that does is that it creates this supraalar pinching on the lateral wall of the nose. Now, some people are just born that way. Other people get that type of effect after a rhinoplasty. What that can do is that it can create lateral wall collapse and you can have more difficulty breathing. But I don't think that Keanu had a rhinoplasty. I think that he was just born with this type of anatomy to his nasal tip. Keanu also has strong chin and jawline structure, and that gives him a very impressive masculine type of look. In 1991, at the age of 27, what I'm seeing is that Keanu has infraorbital hollowing, just like me, with the left side being more hollowed than the right, and that speaks to facial asymmetries that we all have. But I have to say that overall, Keanu's face is quite symmetrical in terms of his brow position, in terms of his nasal base position, and just in terms of general cheek and bony structure from one side to the other, looks quite symmetrical overall. In 1992, at the age of 28, you can see that Keanu has a hairline with a natural widow's peak. And you can also see the different irregularities that exist at his hairline. So in designing a hairline surgically, we always try to make it irregular, but still have some sort of general pattern to it. But you can see a natural hairline like Keanu's exists in a non-uniform type of way, and that makes it look even more natural. And we try our best with surgery to recreate that. In 1993, at the age of 29, I see no further change. In 1994, at the age of 30, what I'm noticing here is that Keanu naturally has a relatively flat mid-face. He has no major cheek prominence. If someone has a flatter mid-face and they're looking to augment it, right? They're looking for more volume. Ways to do that would be non-surgical, such as fillers, and some people end up getting something like cheek implants to further augment the mid-face. In 1995, at the age of 31, I see no changes, and that's the same through 2004. In 2005, at the age of 41, I'm noticing that the face just looks fuller. Now, this could be because of filler, but it can also be just because of weight gain. Now, given that reduced jawline definition, I think weight gain is more likely here than the introduction of facial fillers. Because usually with facial fillers, there are specific areas where you see some increased volume, but typically not throughout the entire face, unless the person's been getting fillers for many years. As you know from many of our other videos, fillers definitely have the tendency to migrate and to spread beyond their original injected position, especially if there are large volumes being used over a long period of time. Subscribe to the channel and turn on notifications to be the first to see our new videos. I always do my best to engage with early comments. In 2006, at the age of 42, I see no change, and this is the same through 2008. In 2009, at the age of 45, what I'm seeing here is that I think Keanu has started to get Botox injections. Usually, these are done into the forehead, glabella, and crow's feet to reduce the wrinkles. And in men, typically higher doses of Botox are needed to get the same effect compared to in women. And that's because the muscles tend to be thicker, stronger, and they require higher doses to essentially stun or knock down with the Botox. When you have, say, the forehead, and for women, you might use a dose of, say, 20 to 30 units of Botox to get the reduction of wrinkles. In men, you're looking at typically at least a 50% increase in dose to get that same impact. In 2010, at the age of 46, I see no change. In 2011, at the age of 47, also no change. In 2012, at the age of 48, I'm seeing some signs of cheek and or under eye filler. So now the face looks fuller, but specifically in that mid-face under eye region. And as far as the different types of fillers that are used, usually the under eye area will need a filler that is not too hydrophilic, where it attracts a ton of water. All filler with the HA that's inside of it attracts some degree of water, but you don't want it to attract more than necessary, because in the under eye area, it can start to look too filled and too puffy. So something like Restylane L is a great choice for the under eye area. On the contrary, when you're looking at injecting the cheek areas and getting some increased volume in the cheeks, usually something that's higher G prime, such as Restylane Lift, is a nice option for giving that more full cheek look. And so my guess is that he probably if he did get filler, got a combination of several different types of fillers that could improve each of those areas. In 2013, at the age of 49, I see no change, and this is the same through 2016. In 2017, at the age of 53, there are some signs that Keanu has some upper eyelid dermatochalasis, which is excess skin of the upper eyelids, and he has progressive eyebrow descent, which occurs in all of us as we get older. And I look through the more recent years to see if maybe he had a brow lift done, or maybe he had an upper or lower blepharoplasty done, which is eyelid surgery to try to address this excess skin, but I really don't see signs of that. So in 2018, at the age of 54, I see no change. And this is actually the same through 2023. So at this point, Keanu is 58 years old and he's such an icon. Just saw him in John Wick 4, loved it. And he just looks very youthful. And this is a testament to his physical condition. And I think it's also a reminder of how important good skincare is. And even if you get some Botox and filler over time, but if you combine it with proper skincare, you can really end up looking younger than your years later on in life, even without cosmetic surgery. As far as total cost goes, I estimate about $150,000 for the Botox and filler procedures over the years. And here's a comparison image from over the years. How has Paul Rudd managed to stay so young looking? He's known for his charming and seemingly ageless appearance. Paul Rudd has been a household name for over 20 years. But has plastic surgery ever played a role in keeping the actor looking so youthful? In 1992, at the age of 23, Paul has equal horizontal thirds of the face. He has slight signs of frontotemporal recession. Paul has left eyebrow ptosis compared to the right, and possible left eyelid ptosis as well. He has natural tip bulbosity. He also has a soft gonial angle, but a prominent chin. In 1993, at the age of 24, Paul has a relatively thin upper lip. Paul also has full upper tooth show on smile. In 1994, at the age of 25, you can see here that Paul has some under eye hollowing. Almost all of us have these in our 20s, and it's not necessarily an indication of an aged face. And it's also not a reason to necessarily run and get plastic surgery or injections. In 1995, at the age of 26, you can already see some static wrinkles forming on the forehead and the glabellar area. In 1996, at the age of 27, Paul has a dorsal hump that is visible, but his nasal dimensions work well with his stronger chin. And in 1998, at the age of 29, you can see that Paul has been experimenting with various beard styles. In the year 2000, at the age of 31, I see that there's increased upper eyelid hooding, and that is usually a combination of gravity, skin expansion, as well as the brows starting to droop. And it's not severe enough here, but in some cases the field of view can be impacted, and then people might choose to get a procedure such as a blepharoplasty or a brow lift to improve their field of view, and insurance companies will often cover those types of procedures. In 2005, at the age of 36, Paul has this triangular patch of hair that's missing between the mustache and the cheek hair, and this is a common type of phenomenon that I see in my practice when people come in looking for a beard hair transplant. Oftentimes they'll have this little missing gap. Sometimes it is filled in and some people want it filled in, but many patients actually want to recreate that missing triangle there. And it's not clear why exactly. There's no hair in that area for most men, but that is very common. But some people naturally have a filled in area there. I think it allows for a better distinction between where the mustache ends and where the cheek begins. Before we continue, make sure to subscribe with notifications on. In 2009, at the age of 40, I see that there are some signs of weight gain, and you can really see it in the midface and in the submental area. That's a question that I often get, is what can we do about this area underneath the chin, essentially in the central neck, to improve the contour? And we made a video a little while ago that addresses
all the different options that there are. So make sure to check that out. In 2010, at the age of 41, I'm seeing some early minimal jawline skin laxity right around the jowls, but it's very minor. And you can see that Paul has great skin, so he clearly does a lot to take good care of his skin. And that usually includes proper cleansing of the skin, proper moisturizing, as well as good sunscreen protection. In 2011, at the age of 42, you can see that his weight has declined based on his facial composition. And changes in our weight can affect the way we look. Sometimes it can make us look older if we gain weight, other times it can make us look younger, and vice versa. Weight changes really do have a significant impact on how we perceive our own age and how we perceive the age of others. I think in Paul's case, as he loses weight and the face gets thinner, he actually tends to look younger, in my opinion. In 2012, at the age of 43, I'm seeing that the hairline has remained extremely stable. Perhaps he's been on finasteride this whole time, or maybe he just has great genetics. But for most people, by the time we hit our 40s and 50s, there's more significant signs of thinning of the hair and continued recession compared to what I'm seeing with Paul. So maybe he has been on some medical therapy. Keep in mind that with medical therapy, the only type that's truly preventative is finasteride or its stronger cousin, dutasteride. To find out more about these medications, head to feelconfident.com. And in 2014, at the age of 45, there has been additional weight loss from what I can see. In 2018, at the age of 49, there is some platysmal banding that's visible in the neck. Remember that the platysma is a continuation of the smaz that we see in the midface. As you head down into the neck, you start to experience the platysma muscle. And when we do facelift surgery, the midface with the smaz and the platysma is lifted together as one complex in order to restore the positioning of various elements of the face and neck. You can also see in Paul's case that there's continued descent of the lateral brow. And that's because of the temporal line that runs right through here. And anything lateral to the temporal line sees less support, and so it droops more over time. And that's why when it comes to brow lifting, there's been a shift more towards lateral brow lifting as opposed to complete brow lifting, because it tends to be a more natural type of outcome. In 2020, at the age of 51, I'm seeing some temporal thinning. And that's right here in this temple area. There's just more hollowing and thinning. And that is what happens to most of us as we age. Now, some people go in for filler injections into that area. But one of the big mistakes that I see is that people get overfilled, and now the temple is projected more lateral than the lateral aspect of the cheekbone. And that ends up looking very unnatural. In 2021, at the age of 52, I'm seeing some signs of potential under-eye filler. To me, he has fewer signs of hollowing than he did when he was much younger. Remember, with under-eye filler, you want an HA filler that is not too hydrophilic or doesn't absorb as much water as some other fillers. So the most commonly used one would be Restylane L, and now Restylane also has a eyelight filler that is specifically designed for the under-eye area. And in 2022, at the age of 53, I'm seeing some signs of potential veneers. There's some improvement in his pearly whites. And in 2023, now at the age of 54, I'm seeing no signs of additional changes. And so I just wanted to say here that Paul Rudd has aged remarkably well. And there are different potential reasons for this. Of course, genetics plays a role. Some are just born luckier than others. But surely healthy living is another big component of this, and that includes physical well-being as well as mental health and proper dieting. Also, the way that we care for our skin is extremely important for optimizing the aging process. And tastefully done non-surgical procedures or surgical procedures can in fact keep us looking fresh and rejuvenated over time. And maybe it's not a coincidence that one of Hollywood's nicest guys, who seems like a great family man, is aging extremely well without plastic surgery.
and the total cost of these potential procedures is $35,000. Leonardo DiCaprio, a name synonymous with talent, heartthrobs, and an incredible acting range. But is his seemingly ageless face all natural, or is there a surgeon's skill involved? Let's investigate. In 1993, at the age of 19, Leo has a widow's peak. He also has a strong anterior temple point. He has relatively high brows with some degree of arching. When I look at his nose, Leo has tip bulbosity and he has some dorsal convexity, which is the shape of the nose that you can see from a 3/4 view or the side profile, where there's essentially a bump on the nose, but it looks like the bump is a bit lower than where the bones are, so it's primarily cartilaginous in nature. Leo also has a strong jawline. In 1994, at the age of 20, what I'm seeing here is some congenital dermatochalasis, which is excess upper eyelid skin, and he has more of it on the right side than the left side. And related to that, there's reduced supratarsal show, and you can see that more on the right side, where the supratarsal crease is essentially hidden by that excess skin coming down. In 1995, at the age of 21, what I'm noticing is that Leo's left eyebrow is higher than his right. He has natural under eye hollowing, and he has a relatively short philtrum with prominent upper tooth show. We have a video on the channel where we went around New York City looking at billboards, and what we found is that there's this common feature of short philtrums. Take a look at that video. In 1997, at the age of 23, this was the year of the Titanic movie. And what I see are some signs of a potential rhinoplasty, specifically that the tip has been refined. Remember that there are different ways of doing rhinoplasty surgery. Specifically, there's an open approach and a closed approach to how you access the cartilage and the bone of the nose. Many celebrities look to avoid any type of external scar, so they often opt for a closed approach. With a closed approach, the incisions are all made on the inside of the nose. You don't get an exterior scar right at the base of the nose. Despite some of these changes to the tip of Leo's nose, there's still some semblance of his prior nose. There's still some bulbosity present, so it doesn't deviate too far from where he started. There are different ways to adjust the cartilages of the tip of the nose. Most often, a small amount of the cartilage is removed to take away some of its curvature so that it flattens out. There are more extreme forms of that procedure where you can actually reconstruct the entire lateral crura of the tip of the nose. And that's sometimes done, but in Leo's case, I think that was not done. And I think he had a more minor adjustment to those tip cartilages. I think if you're looking to stay natural, it's important to be conservative when it comes to adjusting the nose in general, but specifically the tip cartilages. Because once you make more aggressive changes to the nasal cartilages, you run the risk of causing different breathing problems or just changing the aesthetics of the nose to the point where things start to look very different than where you started. In 1998, at the age of 24, I wanted to go back to rhinoplasty surgery because there is a recovery process to it. Usually it takes more than a year to see your final results. And what I think we're seeing here with Leo is that there's further shrink wrapping of his nasal skin envelope as time has passed and as more recovery has taken place. Skin envelope healing can be somewhat unpredictable. No matter how successful the surgery is, you can't fully control how the skin envelope contracts back down to fit the underlying structure that you've created on the inside. And you'll see a longer recovery the more thick your skin is. Some people ask, how can you tell how thick my skin is without doing the surgery? Well, I look at the ala of the nose, and that gives me some guidance as to how thick the skin is. The thinner the ala, which are the wings of the nose, the thinner the skin envelope likely is. The thicker it is and the more rounded it is, usually that means that the skin is going to be thicker. And you can use that to guide the discussion of how long one's recovery might be after a nasal surgery. In Leo's case, I think that the ala are moderate thickness. So I think that his recovery time is somewhere in the range of a year to a year and a half for full recovery, specifically when it comes to the swelling aspect after a rhinoplasty. In 2001, at the age of 27, you can see that Leo's eyebrows have started to descend. And this is something that happens as we age.
usually in our late 20s into our 30s. That's when we start to see this process taking place. In 2002, at the age of 28, there's more recession and thinning of his hairline compared to 9 years prior. You can see that the right side is recessed more than the left. And this is the case in about 90% of people. No one exactly knows why, but it's something that I've experienced in my practice as well. A good way to stabilize your hair and prevent further loss is with the use of finasteride, which blocks the conversion of testosterone to dihydrotestosterone, which is the more potent form of testosterone and which causes miniaturization of our hair in the DHT sensitive zone. To obtain finasteride, check out feelconfident.com. It gives you the ability to get these hair medications delivered directly to your door at lower prices than the competition. I'm also seeing that now that Leo's eyebrows are lower, the upper eyelid dermatochalasis is more enhanced. You can see that now the left side supratarsal show has been reduced. In 2003, at the age of 29, I wanted to point out the lower eyelid orbicularis oculi prominence, and this is caused by the use of those muscles over time, causing some degree of hypertrophy. When it comes to the orbicularis oculi muscle, there are different portions of it. There's a palpebral portion, which is more on the inside of the muscle, and then there's the orbital segment of it. In this case, the hypertrophy that we're seeing is because of the palpebral portion of the muscle. On the contrary, when people are getting Botox for crow's feet wrinkles, they're actually getting that Botox placed into the orbital portion of the orbicularis oculi muscle. That orbital portion is fairly superficial to the skin surface, and it's a relatively thin muscle. So if you inject the Botox too deep, you can actually affect some of the smiling muscles deeper in the face, and that can change the smile. And that's a complication that's sometimes seen with crow's feet Botox. In 2004, at the age of 30, what I'm seeing here is that Leo has these forehead rhytids that are becoming more static. And that's what occurs over time. As you start to get these lines and creases in the face, they become more etched in. And that's the difference between static and dynamic wrinkles. Dynamic wrinkles, my 4-year-old daughter has, and we all have. As we animate, you start to see these different creases forming. But the static ones are what occur over time as we age, and they're visible even at rest. And again, when it comes to Botox injections, the efficacy is much worse when you have very deep static wrinkles compared to when those wrinkles are just in their dynamic form. And also keep in mind that for men, Botox injections are usually required at higher doses to accomplish the same result compared to women. But just to reiterate, I don't believe that Leo has had Botox injections at this stage. In 2006, at the age of 32, there is slight facial weight gain that's specifically visible throughout the cheeks. In 2007, at the age of 33, we're beginning to see some slight submental fullness in Leo's neck, and the glabellar rhytids are becoming more prominent. In 2008, at the age of 34, I wanted to bring up the central mustache area. That's right at the Cupid's bow region. And what I see is that Leo has minimal hair growth in that area. And we see that commonly. Some people come to me wanting a hair transplant to improve the density of that region. But what we find is that the survival rates of the grafts are generally lower compared to other parts of the face and the scalp. And it's unclear exactly why that is, but my theory is that there's a watershed area there because the vasculature to that region of the central mustache comes in laterally from either side. So you have contributions off of the facial artery, such as the superior labial artery and the facial artery itself, that's giving blood supply to the area, but it comes in from the sides. As you get to the center, there's a weaker blood supply there, and that is what is called a watershed zone. And that's why I think we most likely see this reduction in survivability of the grafts directly there. It doesn't mean that the grafts won't survive at all, there's just a lower chance of survival in that zone. In 2009, at the age of 35, I see no change, and that is the same through 2017. In 2018, at the age of 44, we're seeing continued gradual brow descent and upper eyelid hooding. The supratarsal crease is only partially visible now on both sides. In 2019, at the age of 45, there's a change to the cervicomental angle. And compare this to Leo at 25. It makes sense that over the course of 20 years, there's been some additional fullness added here, and that changes the angulation of the cervicomental angle. And this is due to a combination of fat that exists in the deep platysmal space or subplatysmal area and the supraplatysmal space, which is the area between the platysma muscle and the skin surface. Keep in mind that procedures such as liposuction, cool sculpting, and Kybella only target the supraplatysmal space, or the area that's in front of the platysma muscle, which is more superficial. It doesn't get to the deep areas. In order to get to those deeper fat deposits, you would need to do surgery for access. In 2020, at the age of 46, I'm noticing that there's a more prominent frontal scalp to temporal scalp transition. And this occurs as the temples start to thin out over time. Some people start to get fillers into the temples to adjust for that thinning, but you need to be careful not to lateralize the face too much in that area. In 2021, at the age of 47, I'm seeing that Leo has increased lower face and neck laxity, and that's a very normal occurrence for someone in their late 40s. In 2022, at the age of 48, there continue to be some weight fluctuations, but I don't see any obvious signs of filler injections. In 2023, at the age of 48, in addition to the wrinkles that he has in the forehead and the glabellar area, there are now some more prominent wrinkles seen in the crow's feet region. And the total cost of his potential procedures is $20,000. Over the years, we witnessed Zac Efron's journey from teenage heartthrob to the leading man that he is today. But has Zac undergone plastic surgery to achieve his stunning facial features? Or are these changes simply the result of natural aging and lifestyle choices? In 2004, at the age of 17, Zac has a boyish hairstyle. You can barely even see his forehead. He also has thick eyebrows with some arching. This is a bit more arching than you'd see in a typical male eyebrow, but you'll see the correction that occurs later on in this video. He also has prominent orbicularis oculi muscles, and you can see that right at the lower eyelid. It's not that he has fat bags that are prominent in the lower eyelids at 17, rather he has a prominent muscle that makes it look like there's an eye bag. Zac also has a thin and relatively flat upper lip. If you follow his upper vermilion lip, you'll see that laterally it's quite inverted. He also has a central incisor gap and a strong chin. In 2005, at the age of 18, what I'm seeing here is that Zac has a relatively flat nasal bridge. He also has mild tip bulbosity and mild alar flaring. When you look at the width of his nasal base, you can see that it's not quite aligned with the medial canthi of the eyes. Instead, the nasal base appears slightly wider than that distance between the eyes. In 2006, at the age of 19, now what I'm seeing is that there is a closure of the gap between the central incisors. So maybe this is the result of braces that he had or potentially veneers that were placed. In 2007, at the age of 20, I'm seeing the results of a potential rhinoplasty surgery. The tip bulbosity has been reduced. It's not quite as round and as wide. There's also a slight increase in infratip prominence. That's the area at the base of the nasal tip. Sometimes we discuss the supratip, and that's the area right at the top of the tip as it gets into the dorsum of the nose. And other times, it's the infratip that's relevant. And in this case, it looks to me like there's a little bit more prominence in that infratip area. Also, I think that Zac's nasal bridge may have been narrowed, and that's usually done by adjusting the nasal bones through osteotomies. In 2010, at the age of 23, referencing what I said prior, you can see that Zac now has eyebrows that appear more horizontal. And this simple grooming change now leads to a more masculine appearing face. He also has reduced infrabrow space, which gives him a more mature look. In 2012, at the age of 25, Zac has a youthful hairline,
but he's entering the age of when we start to see accelerated hair loss. And that's usually in our mid-20s, late 20s, into our early 30s. And for most men, that's the time when we lose more of our hair. So in order to protect the hair, that's when we start to get into discussions of finasteride to reduce the levels of DHT that cause the miniaturization of our hair, and sometimes also minoxidil to help stimulate the growth of our hair. So for those medications, we always recommend you go to feelconfident.com for more information. My guess is that Zac may have explored these medications around this time. In 2014, at the age of 27, what I see here is potentially the result of another rhinoplasty procedure. It looks to me like the tip has been further narrowed. When you look at the way that the light hits the tip of the nose, you can see the light reflex off of the tip. There's 2 spots there, and that to me is more narrow than it was prior. And as you follow the dorsum of the nose from the top down to the tip, you'll see that the width looks about equal, whereas in the past it used to come down and get wider as you got to the tip. That to me suggests a gentle refinement that has changed his look. In 2020, at the age of 33, mostly what I'm seeing are weight gain changes. You can see the result of that weight gain in his facial features. One way to tell that it's more related to a weight change rather than actual procedures is to, of course, look at the rest of the body, but also to see that the weight increase is now diffusely throughout the face. It's not just one area that's been enhanced, but rather from the temples down into the cheeks, into the lower face. You can just see that there's more volume there. But in 2021, at the age of 34, this is when we're seeing more significant changes to his face. The cheeks, the jawline, all look more refined. His chin, for example, protrudes further than it did in the past. Compare this back to 2011 in a profile view, and you'll see that now that chin has more extension forward than it did previously. There's also increased width to his gonial angle. So if you look at the lower mandible from one side to the other, you'll see that there's increased width right here. And if you follow the temples down and you look at the contour, look how it starts to slope outwards. And this is similar to what I discussed in my Cristiano Ronaldo facial analysis. So what may have happened to cause this change? According to Zac, he fell at home, hurt his chin, and then during recovery, his masseters got enlarged and grew more than they did in the past. Now, is that possible? Maybe, but I've dealt with treating a lot of facial trauma in the past, and I never saw that type of impact on the masseter muscle, specifically from a chin injury. So have I ever seen that in my clinical practice? No. Is it possible? Maybe. As they say, hey, you never know. Other possible explanations are the following. One is that maybe he did have a fat transfer procedure, and I did a short on exactly this topic on Zac Efron around the time that this was happening, and in that video I speculated that potentially it was the result of a fat transfer. But now I think differently. I think odds are that he may have had a custom 3D printed jaw implant along with cheek implants. For me, I'm seeing too much change to just attribute it to a specific chin trauma, and I'm seeing bony changes that I think go beyond the effects of what a fat transfer can do. And because of how regular and symmetrical the increased volume is, I think it's more likely implants rather than a filler type material. I also see some signs of added lip filler. In 2022, at the age of 35, it's possible that Zac may have had some jawline filler. There is now a smoother transition from his chin to the body of the mandible. It's also possible, though, that he may have had a revision of that lower jaw implant. When you look at the gonial angles, they do appear less wide. So could this be a revision of his prior implants? Maybe, but it could also be that some areas got smoothed out with the application of filler. The total cost of these potential facial plastic surgeries is $100,000. In our review, we've observed some changes in Zac Efron's appearance that may spark discussions about cosmetic procedures.
despite his denials. But it's crucial to respect his privacy and the choices that he may or may not have made. Let's continue to appreciate his work and the natural evolution of his appearance with kindness and understanding. Ever been curious about Conor McGregor's hairline? The legendary UFC fighter is renowned for his fierce battles in the ring and his unmistakable style. Join me as I delve into a hair transplant analysis of the notorious MMA. There's a lot to learn from his hair journey. In 2013, at the age of 25, Conor has a central hairline position that's appropriate for his face. He has mild frontotemporal recession, and you can see that in the corners of his hairline. He also has strong frontal, mid-scalp, and crown density at this point. And he does have a scar on the left posterior temple. In 2014, at the age of 26, I see some temporal thinning. So there's recession now, not just of the corners, but also of the temple area right here. But if you look closely at his hairline, there's an irregularity to it and a fineness that's quite natural. And those are some of the defining characteristics of a natural hairline. In 2015, at the age of 27, right at the frontotemporal corners, Conor is partially masking the recession with the temporoparietal hair that is coming in from the sides here, and he's combing it forward. But the central hairline is at a proportionate height relative to the midface and the lower face. You can see here that the midface is vertically his shortest segment of the face. In 2016, at the age of 28, now that he shaved his head, you can see the natural hairline pattern that's well visualized in this photo. There's both micro irregularity to the hairs, but there's also macro irregularity in that the hairline, as you follow it from left to right, has this undulating type of pattern. And we talk about this type of patterning in our video called How to Fix a Receding Hairline. And if you look at the directionality of his hair right at the hairline and in the frontal scalp, there's this standard type of fanning pattern. So essentially the direction of the hair is anterior or forward facing, and as you go from left to right, it basically fans around. And so when we do surgery, we try to recreate that if that's the patient's baseline pattern. But keep in mind that there are many other variations. Given Conor's age in these photos, I wanted to mention that the worst time for male pattern hair loss to accelerate is usually in our mid to late 20s into our early 30s. That's when hair loss is the most aggressive. And during those times especially, it's important to be on medical therapy for your hair to both preserve it and to give it the most full appearance that it can have around that time, and of course in later decades as well. To learn more about prescription hair medication and other things you can do to bolster your hair, head to feelconfident.com. In 2019, at the age of 31, what I'm seeing here is that the right side of his hairline is now more receded than the left side. And this is the case for about 90% of men. And it's unclear exactly why, but I see it in my practice all the time. Not only is the right corner more recessed, but in most people, the right side of the forehead is also your wider side and the side that tends to be more curved. And that ultimately impacts on how our hair looks. You can also see in this photo that there's slight thinning at the central hairline. And this is something that happens as we continue to age. And in 2021, at the age of 33, initially I saw no change when looking at these specific photos. That was of course at first glance. But as I looked through 2022, what I seemed to discover was that it looks like he may have had a hair transplant, most likely around October or November of 2021. In mid-January of 2022, we're seeing some early signs of hair growth at the transplanted hairline. This is now maybe about 2 to 3 months post-operative, and this is when we're first starting to see fresh growth of hair. Remember, initially after a hair transplant, the hair that's transplanted actually falls out, and then it takes a few months for you to start to see new growth. And that growth happens gradually over the course of about a year to a year and a half. And as I look at photos of the back of his head, I don't see any linear scars, so that suggests to me that this was probably an FUE type of procedure. We have a video that covers the differences between FUE surgery and FUT surgery. By April of 2022, you can now see a lower, straighter type of hairline. And you can also see that the temples appear more medialized. They've been brought back in. And by about September of 2022, his hair has reached essentially its full growth potential. And I estimate that the size of this procedure was about 1,400 to maybe 2,200 FUE grafts. And then I looked at his hair throughout 2023. He's now 35 years old. It doesn't appear that he's had any additional hair work done, but what I do see is that there's actually a weakening of the hairs that were originally transplanted. So this begs the question of how could this be? He's now 2 years out from his purported hair transplant, and we're seeing that the hair is actually looking thinner. Now, I think there's two main reasons why this may have occurred, and the first is because of the FUE technique. Follicular unit extraction is the most widely used harvesting technique in modern day hair transplant surgery. And while you get to skip the linear scar in the back of your head, one of the problems with it is that you need to harvest over a broad area on the back and sides of the head in order to disperse the harvest so one area doesn't look over harvested or overly thinned out. As you do that and you broaden your harvesting zone, you essentially are going into areas that are not completely safe as far as DHT sensitivity. So if you go into areas that are DHT sensitive, what happens is you're taking out hairs that are genetically programmed to eventually fall out anyway. And if you take some of those hairs and you move them to a new location, they're eventually going to fall out because that's what they do unless you're on some protective medications. If you're not on any medical therapy like finasteride, you're eventually going to lose those hairs that were programmed to fall out from the get-go. And so I think that he may have had either a very broad FUE harvest where some of those hairs were DHT sensitive, and or he probably was not on the protective medications that then led to that hair that was transplanted falling out. One of the positive attributes of his hair transplant is that they used, it looks like, mostly single hair grafts right at the hairline. And as I look closer, it looks like it's not just at the first few rows where single hair grafts were used, but also further back for that entire inch and a half of transplanted hairline. Now, it's possible that they intended to do that, even though in a natural hairline, you only have single hair grafts, usually at the first few rows, and then it builds into heavier grafts. So what's another reason why this may have occurred? Another reason this happens is because the punch size that's used for FUE is sometimes too small. The intention is good. The surgeon wants to minimize the size of the scars. So to have smaller scars, you have to use then a smaller punch. But as your punch size gets too small, you end up partially transecting your grafts. So instead of catching those 3 and 4 hair grafts, you end up only capturing, say, a single or maybe a double out of that, and the rest get transected because your punch size is too small. In terms of aspects of his hair transplant that I think could use some improvement, we have the appearance of the hairline that looks a bit too straight across. In natural hairlines, especially as we reach our mid-30s and beyond, the hairline tends to have a slight bit of curvature as you get out to the sides. If you make it perfectly straight, it looks a bit artificial. Also, the hairline was brought down quite low. As I said earlier in the video, to me, his facial proportions were great to begin with. So now they've lowered that hairline, including centrally, down. So now it looks like the top third is a bit short. The transplanted area also lacks density, and we've spoken about why that might be with the possible partial transection or the overuse of single hair grafts. And of course, for the potential of progressive thinning that may have occurred as DHT sensitive hair was transplanted. Also, if you look at his temples, the hair direction and angulation appears a bit unnatural, in that the hairs were not placed flat enough. In order to do that, when I operate, I make sure that the head is quite flat and then I'm right there over the patient creating the sides. And I like to use very fine blades with a fine blade handle that allows my hand to get quite flat to recreate that type of angle when it comes to temple work. It's very important, or else it's a dead giveaway that a hair transplant was done. Let's take a look at Tom Brady to see if he's had any facial plastic surgeries over the years. At the end, we'll go over the cost of these procedures. In 2001, at the age of 24, you can see that Tom has frontotemporal recession. He's about a Norwood 2 in these photos. His eyebrows are very distinctive. You can see that they're oriented horizontally and there's good thickness to them. It's pretty much how it is in men in ideal aesthetics. In women, you get more of an arch. In men, it's a bit more horizontal along your supraorbital
ridge here. The upper eyelids have a bit of hooding there. Now, this could possibly be due to brow ptosis. It could also be that he has some excessive upper eyelid skin, and he may have some element of eyelid ptosis. If you look at his nasolabial angle, it's at about 90 degrees, which is, again, very classic for male aesthetics. He has a short philtrum with full dental show on smile. He also has a strong jaw structure and that classic chin cleft. In 2002, at the age of 25, what you're seeing here is that Tom has this prominent brow ridge. Of note, in facial feminization surgery, this is often what gets shaved down, since it's a fairly distinctive masculine trait. So by shaving down this bone and reducing that, you can arrive at a more feminine face. He also has these static wrinkles forming on the forehead and some under eye hollowing, like me. In 2003, at the age of 26, I'm not seeing any changes. In 2004, at the age of 27, there are no changes. But what I wanted to point out here is nostril asymmetry. This is very common, and I get asked about this all the time. And basically, if you look at Tom's nose, on the left side of his nasal base, you can see that that side is his wider side. It's more stretched out, and the nostril just appears different compared to the right side, where it's taller and it's less wide. And some people are bothered by this for some reason, and they want this to be corrected and to be perfectly the same. And it's literally like impossible. It's not technically possible to correct it completely, because you have a totally different three-dimensional element to the nasal base from one side to the other in almost everybody. So while sometimes the nostrils can be made to look a little bit more similar, it's really, really impossible to make them exactly the same. In 2005, at the age of 28, I'm not seeing any further changes. In 2006, at the age of 29, what I'm seeing here is just that Tom has a very full upper lip. He has almost a 1-to-1 ratio with his lower lip. And I don't think he's had any filler. I think that's just a natural trait for him. In 2007, at the age of 30, you can see in these photos that the left eye actually sits lower than his right eye. And again, that comes back to the whole idea of facial asymmetry being very normal in all of us. His left gum line is also actually slightly lower than it is on the right. And I wanted to point out here that when you look at the nose, there's this double light reflection, and that has to do with the way that the tip cartilages are arranged and the way that the light bounces off of it. So if you have a singular light source coming straight at you, there's just going to be usually one spot of light on the tip of the nose. But if you duly illuminate from either side and you have light that's hitting you for a photograph, you're going to display these light reflections off of the tip of the nose, and that can be really useful actually prior to rhinoplasty surgery, because you can really show sometimes how different one side is from the other and how that can be somewhat adjusted with surgery. So also notice how there's no tip bulbosity with Tom Brady's nose. And that, again, it has to do with the shape of the lower lateral cartilages of the tip of the nose. In 2008, at the age of 31, I initially thought that maybe he had a brow lift here because I'm seeing some reduced hooding. But with the next set of images, what I was able to see is that it's, I think, more of a result of an upward gaze in these photos rather than him having had any sort of procedures done. Also, what you're seeing here is that he has upper tooth show on repose. So when he just opens his mouth, he has those upper teeth visible. And, you know, we've done many videos on philtral lengths and the ability of shorter philtrums to usually reveal more of the upper teeth, and how that's a more youthful, preferred appearance for many people. In 2009, at the age of 32, I'm not seeing any changes. Please make sure to subscribe to the channel and turn on all notifications. Thank you. In 2010, age 33, no further changes for Tom Brady. Same with 2011, 2012. In 2013, at the age of 36, I just wanted to note here the forehead, glabella, crow's feet lines on his head that are becoming more etched in. So he clearly is not having any Botox done. And those lines, even in a more rested position, you can see on his forehead here in the picture on the right, those lines are becoming etched in, and that's what people talk about preventing with the use of Botox. In 2014, at the age of 37, no further changes. Same in 2015, 2016, and 2017. Now let's look at 2018 at the age of 41. What I'm seeing here, and people have commented on the change in Tom's appearance, but mostly what I think is going on is that there is a loss of lateral and middle cheek fat. And this is part of the aging process. You can see in this picture, basically he has, like all of us, these different fat compartments of the face. And this is very different from the buccal fat that sometimes you hear about and we've talked about on the channel. Buccal fat is very deep fat relative to other fat in the cheek. These other compartments are your more lateral superficial fat, and it goes through changes over time. So that fat, the lateral superficial fat, tends to atrophy or basically start to lose it as we all age. And that is what I think is going on with Tom. It might also be that, you know, he's changed weight. I think over the years, when you look at all of his photos, you start to see that he's basically trimmed down. I mean, he looks like he's in better and better shape and just has a leaner composition over time. But some of this is also related to the loss of fat that we all experience. So that's why his bony structure gets more defined as he gets older. It's not necessarily that he's had to have cheek implants and all that kind of stuff. I don't think he's had that. In 2019, at the age of 42, what I'm seeing is a slight downturn of his mouth corners. Again, as the aging process takes hold and the cheeks become more medialized and start to come down, it's not as obvious in him as in many other people, but you can start to see some bit of a downward turn to the corners, and also very, very early marionette lines that are beginning to form as well. In 2020, at the age of 43, no further changes. 2021, at the age of 44, what I want to point out here is that he's maintained such a great hairline, and there are really no obvious signs of a hair transplant. And I want to apologize to my friend and fellow YouTuber Lori Hill. She made a video about a year ago and she asked me for my input about Tom Brady's hair. And I said, yeah, I looked at it. I think he's had maybe like 2 hair transplants, but I didn't take enough of a deep dive looking at him, you know, throughout all these years. And so I want to retract my prior statement and apologize to Lori and her fans, you know, who watched that segment. And I also want to say that if you want to name your kid Tom, he's probably going to have great hair. Because have you seen Tom Cruise? Seen Tom Brady? So just an idea. 2022, at the age of 45, now I'm actually starting to see some signs of Botox being applied to the forehead, glabella, crow's feet, the usual areas. You can see this kind of smoother appearance to his forehead and just reduced animation in those areas. So while it does look smoother and maybe he looks a bit, you know, more rejuvenated, it does reduce his ability to create facial expressions. And so that's definitely a trade-off. And he was compared to this character from SpongeBob more recently, which, you know, people can be cruel out there, but I don't think he's had any major procedures done. So the total cost of Tom Brady's facial plastic surgery procedures is $1,500. Has Prince Harry had a hair transplant? Today we'll be looking at Spare author's hair transformation over the years. In 2002, at the age of 19, you can see that Prince Harry has temples that align with the lateral aspect of his eyebrows. This, of course, is a very youthful appearance. Notice how strong his crown hair is. More on that later. In 2003, at the age of 20, given the low hairline, his upper third of the face appears shorter than the lower third of his face. The low hairline also creates a well-framed face. In 2004, at the age of 21, Prince Harry has a great hairline for being 21 years old, but this hairline doesn't work well for someone who's much older, and this is why when people come in for a hair transplant requesting this type of configuration to their hairline, it's not recommended, but it does look great at 21. We have a video on why men should not lower their hairlines, Make sure to check that out. In 2005, at the age of 22, you can see that Prince Harry has a widow's peak. Now, a widow's peak is found in about 30% of men and women. The use of the peak refers to the beak or the bill of a headdress, which widows wore as a hood of mourning dating back from 1530. In 2006, at the age of 23, there are very early signs of right temple thinning, but notice that the hairline shape is overall well maintained. 90% of the time, the right side of the temple or of the frontotemporal angle is going to be thinner compared to the left. It also is usually the side that's more recessed. No one knows exactly why this is, but it's something that I notice in my practice and something that's been documented well in the literature. Now, in 2007, at the age of 24, the shape of the hairline is starting to change. It appears less flat and less straight. The corners are starting to develop. In 2010, at the age of 27, there's increased height to the temples as the hairline has started to slowly recede. This also creates increased forehead height, but he's still all smiles. In 2012, at the age of 29, there's crown loss that you can now see. To go over some of the basic anatomy of the scalp when it comes to hair, especially hair restoration, we think of the hairline that, of course, frames the face, and that extends from the temples into the central hairline and then over to the other side. There's the frontal scalp, there's the mid scalp, and then there's the crown. And then the donor area typically is the occipital and parietal scalp, or the back of the head onto the sides of the head. Those are the most common areas to both transplant to, which is the recipient area, and to transplant from, which is the donor area. In 2013, at the age of 30, we're starting to see some density differences between the DHT sensitive zone and the DHT resistant zones. And this is a reasonable time to start medical therapy, because people ask me, when do I start? Should I have started when I was 18 years old? Not necessarily, but when you start to see these early signs of thinning, that's a good time to consider medical therapy. For first-line medical therapy, we think of finasteride and minoxidil being great options for most people and being taken together, and we prefer them as pills because they're more effective that way. To learn more about medical therapy for hair restoration, head to feelconfident.com. In 2014, at the age of 31, there's increased depth of the frontotemporal corners. People will often ask me about the Norwood scale. In a consultation, they'll say, what's my Norwood scale rating? What would you rate me? And my answer is oftentimes, especially in a clinical setting, who cares? And that sometimes throws people off guard, but the reason for that is that there are many different clinical variants of hair loss, or specifically of male pattern hair loss or androgenic alopecia. And I don't think that most people fall into the strict categories that are assigned by the Norwood-Hamilton scale. So in clinical practice, it doesn't so much matter if someone's a Norwood 2 or 3 or 4, it just matters what their specific pattern is and how we plan to address it. Before we continue, make sure to subscribe to the channel and turn on all notifications. In 2015, at the age of 32, I'm seeing slight weakening of the right anterior temporal peak. This is usually the start of the temple starting to recede and thin out. It starts there in the front, and you start to lose that anterior peak first. And what that does is that it makes the forehead look more expanded, because you're not just losing hair in the sense that the hairline is receding up, but it's also because the sides went back, the temples receded back as well. So when we look to rebuild the hairline, we have to first see if there are enough grafts to invest into the temples to build them up. But if that's possible, that usually is a nice addition to someone's hair restoration. In 2016, at the age of 33, Prince Harry's crown loss appears to be worsening. And in 2017, at the age of 34, I think Prince Harry may have had a hair transplant around this time. The procedure could have been anywhere from 1,200 to 1,800 grafts, possibly more, and the likely recipient areas were the hairline and the frontal scalp. In my clinic, we're performing on par with the world's best clinics, and we have over 60 years of combined hair transplant experience between myself and my staff.
We're looking for patients who appreciate great quality. If that's you, contact us. There's more information in the description below. In 2018, at the age of 35, the results of his first potential hair transplant are now more evident at the hairline. There's a nice natural appearance to the hairline, and we've already released a video on hairline design that I encourage everybody to check out. It goes over what makes a natural hairline. First and foremost, just the way it appears without any surgery, and then what do we do in surgery to try to recreate that same type of naturality. And now it looks like Prince Harry's crown loss is more extensive. In 2019, you can again notice the shape change of the frontotemporal areas. They appear less rounded than they did in prior years before the potential hair transplant. And in 2020, at the age of 36, I see no change. In 2021, at the age of 37, you can see that Prince Harry's hair has continued to thin. Now, this might be because he's not on any medical therapy, or he's on medical therapy but just isn't stable on it. Perhaps he discontinued finasteride due to side effects that some people get, and maybe he just decided not to try anything else. But there are other forms of medical therapy, and we've spoken about them extensively on this channel. They include things like low-level laser light therapy, platelet-rich plasma, microneedling. And when someone is on a standard dose of finasteride of 1 milligram a day, and let's say it's not working for them, what we usually do is recommend switching to the brand name Propecia and trying that out. If that doesn't work, we can always try a higher dose of finasteride or bump them up to dutasteride, which is the stronger cousin of finasteride. Very few people have breakthrough hair loss on dutasteride, but the problem is that the side effect profile is worse on dutasteride compared to finasteride. So we don't start with dutasteride, but for some people, it's a good option if they continue to lose hair on finasteride. In 2022, at the age of 38, you can notice the color difference at the hairline when you look at this image between the transplanted grafts and his pre-existing hairs. And this can occur with a hair transplant where you're taking hair from an area that might have a slightly different coloration and you're moving it to a new location. The hair will usually retain the coloration that it had from its original location. And in 2023, the majority of the hair that remains at the frontal scalp, I believe, may be due to his hair transplant. At this point, Prince Harry has about 30 to 40% of his original density in the frontal scalp and about 15 to 20% of the original hair density in the mid-scalp and crown. Even if he were to get additional hair transplants, it wouldn't bump up his density to the original. That is a point that is important to make because oftentimes when people get a hair transplant, they come in thinking that they're going to get complete restoration and look just like they did when they were 18. But the problem is there really isn't enough hair in the donor areas to accomplish that, especially for someone who has extensive loss throughout the frontal scalp, mid-scalp, and crown. So one must go into hair transplant surgery with very realistic expectations to get a result that they're ultimately happy with. And also we need to realize that people do get additional procedures over time to increase density. And on August 2nd of 2023, Prince Harry was on a call related to his foundation, and the sun was reflecting off of his crown. But there was another area on the occipital scalp that was illuminated. While a bit low, it does look like a potential FUT scar. And it's more visible now that his hair is cut shorter than he usually wears it. Worldwide, most men are getting FUE hair transplants these days. But there is still a role for FUT surgery. Check out this video to learn more about FUT versus FUE hair transplant surgery. Since you like this video on Prince Harry, check out one of our other videos on hair loss.